Assalamu alaikum everyone. In this specimen we are going to look at coagulative necrosis. This is actually the specimen of kidney. Before magnifying and looking into this specimen, I want you guys to really familiar with the normal histology of kidney. Like as you guys can see and observe here that this is the normal glomerulus, and I want you guys to really see and appreciate that we have a lot of nucleuses here, because I know this is our first pathologic lab class and you guys may be not familiar with the normal histology of kidney. So at this point in time I want you guys to be really familiar with, only know that we have a lot of nucleus here in this glomerulus. And if I zoom on the tubules, you guys also see the nucleus in the tubules. So this is how our normal kidney histology look like. Okay, so if I close it, if I magnify on our specimen, you guys can see that we do have this tubular structure. And let me, okay, so you guys can see we do have that tubular structure, but where are those nucleuses that we are observing in the normal specimen? You guys can see this nucleus in the normal specimen, but here those nucleuses are gone. This is actually a coagulative necrosis. What is the definition of coagulative necrosis? The nucleus and fine organelle structures are gone, but the outline of the cell or structure remain for several days. So this is the outline. Only we have outline. Nucleus and fine organelles inside them are gone. So actually I am trying to find the glomerulus here, because this is specimen of kidney and definitely we are going to have glomerulus here. So this is actually glomerulus. So this is glomerulus, but it has undergone the coagulative necrosis. Can you guys observe any of these white these black nucleuses here? If no, so this is coagulative necrosis. So I want you guys to be really familiar yourself with the definition and concept of coagulative necrosis. So we only have outline of structure, but the nucleuses and granules are organelles are gone. We cannot see any nucleus. We only see the outline. This is coagulative necrosis. Very simple to understand. So I have seen in pathology lab that some of the students are actually reading from book that in this specimen we are going to observe coagulative necrosis, caseous necrosis, liquefative necrosis. So you do not need to do that. You guys can observe with your eyes what type of necrosis you are seeing in this specimen. If you guys can see, there is no nucleus, but there is outline of cell. This is definitely coagulative necrosis. In the next video I am going to show you liquefative necrosis. So you guys, after that, I'm really hopeful that you guys can tell the difference between them without looking at book. So before ending this video, I want you guys to show the reminder of the tissue, because here if I start on less magnification, you guys can see here we have necrosis, but at these surrounding tissue we do not have necrosis, but the surrounding tissue is not normal. If I magnify here, can you guys see and appreciate this blue cells? These are also nucleuses, but these are non nucleuses of normal kidney tissue. These are actually lymphocyte infiltration. Lymphocyte are our inflammatory white blood cell that infiltrate the tissue during inflammation. So at this point in time, I know that you guys are not familiar with the concept of inflammation and lymphocyte infiltration, so I do not want to you guys to know really more about it. You guys can know when we study next chapter, inflammation chapter, and you guys are really familiar with it. No, do not worry. But I just want you guys to show that here we have a lot of lymphocyte infiltration, but at side where we have coagulative necrosis, there is nothing, no nucleus. We do have inflammatory cell, but very little. Most of the cell we have do not have any nothing. And here actually I have put markers, one marker here and one here. So if I magnify here, you guys can see that glomeruli in this specimen. So I want you guys to compare this to this. This is not normal glomerulus, this is actually hypertrophic glomeruli. I think you guys are familiar with the hypertrophy right now. Hypertrophy when our cell proliferate and increase in size. Our cell increases in size. So here our cell has increased in size. They haven't increased in number, they have increased in size. They are undergone hypertrophy. So here this white space is actually, this is glomerulus, and I hope you guys are familiar with the normal anatomy of kidney. This is glomerulus, and around it glomerulus we have Bowman's capsule. So this is Bowman's capsule around it. So here you guys can see the Bowman space, and here you guys can see Bowman space. This is very narrow. So this is hypertrophy of our glomerulus. So here you guys can also see the proximal convoluted tubule coming out of the Bowman's capsule, but here you guys cannot see nothing because of lymphocyte infiltration, and this structure has gone. This structure is completely destroyed by some disease. So we can. You guys will really familiar with this disease and all of these things once you study the systemic renal systemic chapter. But now I want you guys to only see and observe this coagulative necrosis. That's all. Thank you.